Okay, so in my previous video I taught you the relations of parotid gland, the apex part, the base and the posterior border. In this video I'll be taking the other parts. One would be the anterior border, which is all these parts. Okay, anterior border includes, we can go in order, temporal branch, then transverse facial artery. Okay, transverse facial artery, temporal branch of facial nerve, transverse facial artery, then comes zygomatic branch, then comes upper buccal and accessory parotid duct and gland and parotid duct, lower buccal, marginal mandibular. So how you are going to remember that there are 5 branches of facial nerve, out of which cervical goes to the apex part. So the rest 4 is here. First of all, temporal, zygomatic, buccal, which is divided into upper and lower, and marginal mandibular. There is an accessory parotid gland and the parotid duct is present. Okay, that is done. And then the extra one is, which is coming, is transverse facial artery. Okay, so that is all lying in the anterior border. So anterior border is done, posterior border is done, base is done, apex is done. Now medial border. Now the medial border is related to the wall of the pharynx. As you can see, this is the medial border and this is the another section of parotid gland which we have taken. This is like this. This is sagittal section. This is cross section. Okay, which we are seeing right now. This is skin. Here is the platysma, superficial fascia along with the deep cervical fascia. This is the parotid gland, this is parotid lymph nodes, and as this passing is the facial nerve. Okay, so these are all the structures that is embedded in the parotid gland. Now medial border, I have told you that it is lateral wall of pharynx, which I have drawn here. This part is the lateral wall of pharynx. Now we are going to do the rest 3 surfaces. So first with superficial surface. Superficial surface, that is, we are going deep into the towards the parotid gland from outside. So it will be like skin, superficial fascia, then parotid fascia, deep parotid lymph nodes. As you can see, skin, superficial fascia, deep parotid fascia, and then the parotid lymph nodes. And once we that is superficial surface. Then comes anteromedial and posteromedial surface. Now the anteromedial surface, here, this is the anteromedial surface. This consists of ramus of mandible, and to this is attached medial pterygoid and masseter. What? Medial pterygoid and masseter. Ramus of mandible, M for mandible. 2 muscles, M for masseter, M for masseter, and M for medial pterygoid. Okay, that is the anteromedial surface. Then comes the posteromedial surface, which is related to facial nerve trunk and external carotid artery. So as you can see, this is external carotid artery, this is retromandibular vein, and this is facial trunk. So that is related to facial trunk and external carotid artery. So these are the relations of parotid gland, and these are the structures within the parotid gland, about facial nerve, external carotid artery, where the superficial temporal vein, artery, and the maxillary artery, transverse artery, they join to form the external carotid artery. And here the superficial temporal vein, the external carotid artery breaks down into transverse cervical artery and superficial maxillary artery and superficial temporal artery. And here you can see the superficial temporal artery and the maxillary vein join to form retromandibular vein. Maxillary vein and superficial temporal vein, they join to form retromandibular vein. Then it divides into posterior division and anterior division. With the anterior division, what join is the facial nerve vein. Okay, so with the anterior division, facial vein joins to form common facial vein. With the posterior division, posterior auricular vein joins to drain into external jugular vein. Okay, in my next video I'll be doing the rest of the